Good evening, everybody. My name's Lizzie and I am the Senior Nutritionist at Saracen Horse Feeds, and a very warm welcome to all of you this evening to our fourth seminar in our series, where we are proudly celebrating our exclusive 20-year partnership with Kentucky Equine Research, world leaders in equine research and nutrition. Following on from the last three wonderful seminars that we have had with Kentucky Equine Research founder Dr. Joe Pagan, and last night Stephanie Valberg, Professor of Veterinary Medicine at Michigan State University, we are really thrilled and proud to bring to you again another fantastic panel of experts. And with no further ado, I will start my introductions, and we're absolutely delighted to have joining us from Australia, Dr. Peter Huntington. So Peter has got up early this morning to join us this evening. Peter is a veterinary expert who also has vast knowledge and experience in equine nutrition and research. And Peter is able to give that scientific and research-based advice with a real practical angle. He's able to support us greatly. I am very fortunate. I call on Peter an awful lot to help me with a lot of the work that I do. And in 1999, Peter became the Director of Nutrition of Kentucky Equine Research Australia, and he continues to be a massive contributor to equine science, research and nutrition. We're also delighted to be joined this evening with Eamon Smyth and Jack Ashby, who are both veterinarians who work with EquiVet Mobile Horse Veterinary Services, which Eamon himself established in 2014 with the simple aim of offering a personal, professional and fully mobile diagnostic and therapeutic veterinary service to horse owners on their premises. Beside me, I have the lovely Katie Powell, who set up Nodwood Equine, which really is the most amazing state-of-the-art equine facility centre, where they offer a great deal of different services from rehabilitation to livery, etc. And it is a phenomenal establishment. We also work closely ourselves, Saracen Horse Feeds, with Katie and her team to help support the nutrition and the feeding and the well-being of their equine residents. Now, we've got a really fascinating evening lined up for you all. We will be answering questions throughout the event, so please feel free to send in any questions as they come about and as you think about them. We will endeavour, if we're not able to answer them all, we will endeavour to answer them after the presentation has finished as soon as we can. And you also can feel free to send us in any other questions, email us at info@saracenhorsefeeds.co.uk. Now, as I said, we've got a huge evening of things to get through with you all, so I'm going to kick straight off. Our subject obviously is equine gastric ulcer syndrome, and we're going to start with Katie, and I'm going to ask Katie to set the scene really for us this evening. And Katie had a horse scoped, and so what we'd like to know, Katie, is could you just take us through the sequence of events and what sort of really happened that led you then to think that actually the next step should be having an investigation and looking at having a scoping?
Thanks, Lizzie. Good evening, everybody. I'm absolutely privileged to be here tonight. This one, we actually see lots of scopes, and we do lots of scopes at Nodwood House, and they range from a vast different number of horses, horses coming straight from operations, young horses, older horses, and they all show different signs. There isn't the tick list which says this horse has got X, Y, and Z, therefore it has ulcers. With this particular horse, the signs were very subtle. So this horse is operating at Grand Prix. He is kept and managed in a very particular routine. His Saddle's fitted regularly, he has regular physio, but from the moment he arrived on the yard, he showed to me subtle signs of ulcers, not the big long tick list that I think we would tend to refer to. So the subtle signs would be some food aggression when it's feed time. We had the sort of kicking of the door, and very keen to feed. We certainly didn't see poor appetite in this particular horse. He's being fed regularly 4 times a day as soon as he moved to Nodwood. We definitely saw some girthiness with him, but from a performance perspective, he is operating at Grand Prix and was doing his job extremely well. I should point out he's 15, so he's an older horse, but physically in very good shape. So they were subtle. Other horses that we've scoped, we've seen loss of appetite. They may be picky between their hay and their hard feed. They're underweight. They're much more aggressive about their rugging, for example. But with this horse that we're looking at tonight as a case study, they were very subtle.
Okay, and I think that's quite important. And I think at this stage we'll bring in Eamon and Jack, is that the signs do vary between individual horses, and also as well, I'm guessing, with the extent of the type of symptoms and the type of behaviours perhaps that they may exhibit. So I think really now over to Jack and Eamon to talk us a little bit more through this, and then also take us through the scoping.
Thank you very much, Lizzie, and good evening, everybody. Thank you very much for inviting myself and my colleague Jack to be part of this evening's talk. Gastric ulcers always is a topic of interest. This particular case that we're about to discuss now is one that Katie brought forward to me. As she said earlier on, she was suspicious that this horse had ulcers before I even examined it. For us as a practice, we deal with an awful lot of performance horses, particularly warm bloods and lacrosses, Irish sport horses and lacrosses, and we deal less so with racing thoroughbreds. So I suppose what we discussed today is our way of dealing with the horses that we see on the ground. We work quite closely with Katie and our rehab centre and with other yards with regards to trying to get management, feeding and everything we can do to try and prevent these horses from getting ulcers and from treating horses that we identify with them. As Katie said, the symptoms for ulcers are very variable. Sometimes they can be very dramatic in the fact that the horse can be colicky and the horse may be losing weight, and they can be girthy. Sometimes it is just a case that the horse isn't performing as well as it used to. So it's very important to try and pick out these cases that you think could potentially have ulcers or maybe have some kind of other underlying poor performance issue. If we can roll on the video, what we're going to do is just talk you through the equipment that we use in order to be able to identify scopes first. So it's a minimally invasive procedure in order to diagnose ulcers. Ulcers, they have investigated several ways to try and confirm ulcers in horses, through blood tests, through fecal analysis, but nothing has been significantly good enough to beat the only way that we have at the moment, which is to pop a camera inside this horse's stomach and physically see whether ulcers are there. So we use a scope which is about 3.5 meters long. It's very important that these horses' stomachs are empty at the time of examination. So we would normally ask for a horse to be starved for about 16 hours beforehand, and for water to be removed from the horse a couple of hours before we actually scope. We would also try and do our scopes first thing in the morning. I think horses get less stressed if they're starved overnight, rather than if they're starved through the day. This is another one of our colleagues, Jose, just placing a gag onto the horse. It's very important that the horses don't chew the scope. It is not possible to pass a scope through the horse's mouth, so it needs to go up through the nose. But sometimes the scope can retroflex and they can chew. So we use a gag to open up their mouth to prevent them from chewing the scope in case we do get retroflexion. Jose's taken the scope here, a bit of lube is put on to try and make it a bit easier for the horse. All of these horses are sedated at the time of scoping. On the left-hand side of the screen, you can see the camera being passed up through the nares, coming now up towards the larynx, where you can see the vocal cords in front of you on the left and an opening down into the windpipe. And what we need to do at this point, as we bring the scope closer, is to get the horse to swallow. So we progress the scope slowly. We position it in the position to get down into the food pipe or the esophagus, and then we wish the horse to scope. Sometimes they swallow it straight away. Sometimes it takes a couple of attempts to get them to swallow. And this is a little bit further on. You see me there pumping up the horse's stomach. This particular horse had quite a large stomach, and we needed to pump air into it to expand it, so we were able to look around the entire stomach. You can see from this picture here that the stomach lies quite far down in the horse, which is the reason that we need these scopes to be so long. So you pass down through the esophagus or the food pipe, down past in between the lungs, down past the heart, and down into the stomach. And the stomach has a volume of about 10 to 15 litres. And when the horse is being starved, this volume is an awful lot smaller because it is a collapsible sac. So I'm going to pass over to my colleague Jack, and he's going to talk you through the first scope that we did on this particular horse and what we found.
Good evening, everyone. Eamon just described then, we've been through a video of the external aspects of the scope. So we're just going to go through now what the scope shows us as we pass it through the horse. So just for, I guess, a bit of anatomy, because it'll be a bit foreign to a lot of you. This is a pretty basic diagram of a horse's stomach. So the endoscope or the gastroscope is going to come down the esophagus here, and so it's going to enter into the upper part of the stomach. The stomach's kind of split into two parts. You'll see it here. There's a very pale part at the top and a much darker part at the bottom. And okay, so we're going to roll the video now, and you can see the diagram up at just that top left corner there. So this is just as Eamon was saying before. We're aiming up to get just above the larynx here, so we can get the entrance of the esophagus, where the horse then swallows and takes the gastroscope down into the food pipe of the esophagus. And so the esophagus is a little collapsed, very soft tube. So what we actually do is just to make sure we're sort of not causing any damage to the horse as we pass the scope down, we're actually just blowing a little bit of air ahead of the scope. So you can just hear that this little soft tube that's the esophagus. We're just opening that up just in front of the scope as we pass it down into the horse's stomach. And this can take a little bit of time to get there because this is quite a big horse, so it's quite a long distance to travel. And what you'll see is just at any moment now, well, there we are, we're just into the stomach. So in the previous video, you saw Eamon pumping pretty hard. The stomach at this point, because it's completely empty, it's like a football that's had all the air sucked out of it, so it's a collapsed sac. So what we have to do is we have to inflate it, and that allows us to kind of have the sort of structure that you can see on the upper left corner of the screen, something that looks like that. So that allows us to then, as we pass the scope into the stomach, it allows it to sort of move around, and then we can gradually visualize all the different parts of the stomach. So with that diagram in the top left, just while the stomach's being inflated, the part of the stomach on the left of that diagram is called the greater curvature, and then the small, almost V-shaped bit on the right of the diagram is called the lesser curvature. And we get ulcers in both parts of these, but we kind of see them with varying degrees of commonality. So you can already see in the scope here that we've got a degree of ulceration in that mucosa there. So the very pale part of the stomach you can see ahead is what we call the squamous mucosa, and that's in the upper half of the stomach. And then the darker part of the stomach lining that you can see below is what we call the glandular mucosa. And they have quite different functions, and they are separated by that very clear line you can see in the middle of the screen at the moment, which is the imago plicatus. And so we've got ulcers there just straight ahead of us. So those are what we call squamous ulcers, and they're affecting the greater curvature of the stomach, so the outer part of that curve. And then what we're going to try and do is we're trying to look underneath where the scope is coming into the stomach. I think with this horse, we just didn't quite manage that. So we're going to pass the scope into the stomach. We're going to come back round and look at ourselves. But with the scope, they're very, very flexible. That's really important. So again, we're not causing any trauma to the horse. They're nice and flexible, don't cause any damage. But we can only steer the tip of the scope. So we kind of have to pass it in and then just see slightly where it takes us. So sometimes it takes a few attempts just to see all the different parts of the inside of the stomach. The imago plicatus, that real sort of definitive line that marks the upper half of the stomach, the bottom half of the stomach, is really quite important because even though you can have ulcers just below it and just above it, they're completely different disease processes that cause them. And so even though they might only be separated by an inch or so, actually they're two different disease processes, and we'll sort of discuss that in a bit more. detail later. So this stomach's pretty empty. You can see there's no food material in there, but we have still got a bit of liquid and clearly some saliva, some frothy material there down at the bottom of the stomach. So a lot of the time when we're scoping, we do sort of have to navigate our way through that. So we end up sort of dropping into this delightful soup on a regular basis. So we're just going to take a few attempts on this scope and we'll get through there and then we'll come out the other side and we'll be able to see a different part of the stomach. But on this scope, what we're doing now is we're just twisting back myself and you can see the scope there coming into the stomach. So we've now turned it round and we're looking back where we came from. Which we'll twist around, you can see this little cave just towards the right of the screen. That's the lesser curvature, and then towards what we call the exit of the stomach, the pylorus, the pyloric antrum. We've actually got some ulcers there as well, affecting the lesser curvature of the stomach and the squamous mucosa there. So we actually said that this horse had grade 3 squamous ulceration, so the part affecting the upper half of the stomach, and so that's one part of it, but it's really important now, rather than just say, okay, we've seen some ulcers, that'll do. We now need to try and get over towards that cave that's on the upper right of the screen at the moment and just check that the area of the stomach, right where you exit, which is called the pylorus, we need to have a good look at that area and just check there's not something else going on there, because we treat the two different types of ulcers a little bit differently. So again, you can see that lesser curvature there is quite ulcerated, but we, as you can tell, we've dropped into that salivary pool again. So we're just going to try and advance ahead. So again, we're just going to dunk down. So the scope has come in. Hopefully you can see the point on the diagram there. And we've come in right down the bottom. So now we're trying to come around the bottom here, as it were, and almost come up to the top. So you can see we're pointing towards the roof there. And then we're just going to pop into this area right next to the exit of the stomach. And already here we can see we've got some considerable ulcers as well. So just to the left of the screen, surrounded by a bit of foam, you can see there's a black hole opening up there. That's called the pyloric sphincter. So that's the exit to the stomach. Beyond that is the start of the small intestine. And in this area around us, we've got these, you call them like chains of raised and erythematous, so pink or red nodules, and there's quite a few of them in this area. Again, so we graded this horse again as grade 3 sort of glandular ulcers. So glandular again being this bottom portion of the stomach, and I guess we do use that as a grading system, but sometimes we like to describe the type of ulcers we see in the bottom of horse's stomach, so these glandular ones, just actually as a description, because they vary in character, and sometimes that might give us indications that we might treat some of them differently. So in these ones, we definitely describe them as sort of multifocal to coalescing raised nodules with erythematous tops. So we're happy with that, so we're just going to slowly back out the pyloric antrum here, and then what we'll do is we'll deflate the stomach just to take the gas out, and then we'll start the horse on some treatment based on what we've seen today. So we'll go through the sort of treatment protocol and then the management changes that we've done for this horse based on that first scope. I'll pass it to him for that.
Yeah, based on this particular clinical case, I suppose we were quite lucky when we scoped this horse that we've seen the two different types of ulcers that we do see in horses. Interestingly, we've seen squamous ulcers in two separate areas, so we've seen them on the greater curvature and on the lesser curvature of the stomach. And these ulcers are ulcers that tend to be associated with feeding management, and they tend to be ulcers that we understand why they happen, and we're very confident that we can fix most of these ulcers with treatment, with proper feeding, and with good management. The ulcers down the bottom of the stomach, the pyloric ulcers, and we need to treat a little bit differently. We don't fully understand why horses develop ulcers in this area, and we know that stress is a factor, but we don't know how stress causes the ulcer. So there is more work in the years to come really to try and investigate the pathways that are involved in these ulcers developing. For the pyloric ulcers, the treatment is omeprazole, and omeprazole is a proton pump inhibitor that is there to reduce the acidity of the fluid within the stomach. As I said, these ulcers tend to be associated with management and with feeding. So tend to be associated with high carbohydrate diets, horses that are in fast exercise, and horses that would also be stressed. The ulcers that are there do tend to respond very quickly to medication, somewhere between 2 and 4 weeks, depending on the degree of ulceration that's there. So for this particular horse and for those ulcers, we put him onto a course of omeprazole. Omeprazole comes in different forms. You can get oral omeprazole, and it is very important that omeprazole is given an hour before feeding in the morning. And that can sometimes lead to some management problems with respect to trying to give this horse the omeprazole in the morning when there's other horses in the yard being fed. This particular case here, this horse had or suffered from food aggression, and we felt that it was going to cause more problems and stress for this horse and for the other horses on the yard if we were going to not feed first thing in the morning to starve the horse for an hour before the oral omeprazole was given. And we made the decision that for this horse, it was better to move forward with an injectable omeprazole form. And the ulcers that are down the bottom of the stomach, our first port of call for practice and what works for us in practice is to use the omeprazole, but also to put them on sucralfate. Sucralfate acts like a plaster, so it forms a plaster over the ulcers that are down the bottom that protects them from the acid that's in the stomach. And it also allows those ulcers to heal by protecting them from the acid that's there. So this particular horse, and then this will open, I'm sure, a conversation later on with questions, because there's various treatment protocols that can be used. But for this horse, we decided to go along with injectable omeprazole, which this horse received. He's quite a big horse. We gave it every 5 days, and we put him onto sucralfate, which he received in his feed twice daily. I mentioned that squamous ulcers will often heal within 2 to 4 weeks, and we don't assume that this will happen. We do always rescope to make sure that these horses have recovered from ulcers. Pyloric ulcers do seem to take longer to respond to treatment. What we would normally do is rescope horses with pyloric ulcers at 6 weeks as an interim scope, with the view that these ulcers may need further treatment. I think a lot of these horses with pyloric ulcers will take 3 months of treatment in order for it to resolve, but we always recommend a rescope of 6 weeks to assess and see where this horse is. I'll pass over to Jack then for the second scope. So we had a rescope at 6 weeks post the start of treatment.
Could I, there's quite a really important question as well that has come while we're talking about the scoping, and while we've actually looked at the anatomy of the stomach as well. And there does seem to be quite a lot of confusion, I think, with people with the glandular area of the stomach, and actually then what constitutes the hind gut. So as a nutritionist, when I talk about the hind gut, I'm focusing on the horse's large intestine. And I think there is confusion out there because some people are referring to the bottom of the stomach as the hind gut. So yeah, presumably I'm correct. You're in agreement. But yeah, there seems to be quite a lot of confusion.
I think it's quite a common thing for confusion on this. Ulcers, people often do refer to the hind gut. Ulcers do occur in the hind gut, and they are, we believe, quite rare. And they tend to be associated with very particular things, parasitism, large doses of non-steroidal anti-inflammatory drugs, can cause ulcers in the hind gut. These can usually only be identified by post-mortem, unfortunately, and occasionally they can be found on ultrasound. But it is important to stress that these types of ulcers, we believe, are quite rare and aren't a significant, do not play a significant role in the gastric ulcer syndrome, as if I can refer to it as that. People, when they talk about hind gut, often mean the bottom of the stomach, which is just where those pyloric ulcers that we showed you earlier on, just where it enters the duodenum. That is in the stomach. It is not the true hind gut, but there is a huge amount of confusion with what people refer to the hind gut. And I think that has just led to confusion generally as to what is hind gut and what is stomach. But there's certainly 2 separate places within the stomach that you would find ulcers. In the squamous and the pyloric regions. Hind gut ulcers do exist, a completely different condition, something that we believe doesn't happen commonly, and it happens for very specific reasons.
Thank you.
Okay.
So I think we're going to move on then to the next scope, which is after treatment. Katie, can you share with us after treatment? Did you notice any significant changes? What did you observe in some of the behaviours as well that you described at the start?
Yeah, so I think by maybe week 4, we were seeing less girthiness. We still see the food aggression with him. I think that maybe potentially a learned behaviour from him now. But just subtly a reduction in when we're tacking him up. He's not quite as sensitive around that area. We haven't got some of the face pulls that we may have seen before. But from about week 4, I think we started to see some changes, and then we did a rescope at week 6, which we're going to take a look at now. And well, I won't want to give away what we've seen, what we're going to see next. So, but it's quite remarkable. So, shall we play that next piece?
So okay, so I'll talk you through the findings of the rescope then. But like Eamon was saying before, a 6-week repeat scope when we're looking to assess glandular ulcers. So again, here's the diagram. So those will be the ones affecting this bottom half of the stomach. That's normally what we almost expect to be an interim scope. So we're expecting just to check on progress. Are we seeing some improvement? And if we are, we're happy to continue with the treatment plan. If we've seen no improvement at all, we do look to go, okay, is this a horse, or actually we're going to be better off using some different treatments? So already you can see here, that's the greater curvature and that's the lesser curvatures of the stomach. The squamous mucosa there, so that's the paler portion. But I don't know if our video's just stopped. Sorry if it has. We just lost that on our screen for a minute.
There we go.
Can we just roll it back a little bit? If that's all right. Sorry, probably a bit further back actually. About 9. What do we say, 9.5? So that's just going to be the end of the first scope. So okay, we'll do that again. That's fine. So this was like our interim scope. So we're still expecting to have to repeat this horse's gastroscopy just to confirm that everything has gone the way we wanted. But again, we like to do it at this point because 6 weeks is a long time to be on a treatment modality if it's not actually producing significant improvement. So we definitely like to do it there because there are other treatment options that we might use in horses if they're not responding to our initial choice, which as Eamon said is, in this case, was injectable methadone or sucralfate. So that's the greater curvature of the stomach, which had lots and lots of small ulcers on it, and then that's the lesser curvature there, just below. And again, that's just that all looks perfect, really. This is the glandular portion of the stomach. Again, just right in the centre of the screen, just slightly above the centre, is the pyloric sphincter, the exit to the stomach. And you can remember last time that we had those big linear raised patches of nodules that were all really pink and red. And what we've essentially got left here is one quite clearly raised nodule, but the surface of it is looking substantially better than it was at the first gastroscopy. And it now has a sort of almost like not quite a honeycomb pattern, but a slightly striated appearance to the redness and a couple of little dark blotches towards the bottom. And we've still got a lot of raised patches. In our experience, they sometimes go away, but they often don't. But their appearance now is far more acceptable to us. It's basically the same colour as the surrounding mucosa, which all is nice and pink. In this video, actually, it's coming back as being relatively light in colour, but it's quite dark usually. So we're really, really pleased with that sort of response to treatment at a 6-week time point. Like I say, we'd just be looking for considerable improvement of these ulcers at this point. Whereas, 6 weeks down the line, we'd certainly expect the squamous mucosa to have completely healed, which in this horse it has. But obviously, we're still pretty pleased with the response to the glandular ulcers of this horse at this time point. 6 weeks is still probably not that far down the line for the severity of ulcers that we had at the first scope. So we're really pleased with how this horse has responded. I don't know, there's a huge amount more from this video there, so we'll pop on to the last one, which is essentially just this horse is still sedated at this point, but looking pretty chilled. Just pulling all of that scope out. But what we had done just before we took the scope out there is we would have just deflated the stomach. So we have a suction pump attached to the gastroscope, and that just allows us to remove the air that was put in there to allow us to navigate it around. Initially, when gastroscopy was being performed in horses, there was a a few cases that were published in the literature that suggested that potentially there might have been some side effects from inflating the horse's stomachs, but thankfully that hasn't really run true long term. But just to be on the safe side, we all actually suck the air out of the stomachs before we finish the procedure.
Super. Thank you very much, Eamon and Jack. I think so. Obviously, we've heard about the treatment process, and I'm glad that Peter's come in now as well, because what I'd also like to discuss before we get into some of the questions which are coming in relation to different types of treatment procedures and protocols. But just going back to this particular instance, and Kate, I'd like to ask you, in terms of any management changes and feeding changes, was there anything specific that you implemented that you weren't perhaps doing beforehand?
Yeah, so I think I suspected this horse had ulcers when it arrived with us. And what I would very much see that we've done now is we've reset. So we now know where we are. We've treated the horse. We've seen the results, which are quite remarkable. Then we roll into our good management practices, which would be trickle feeding, ab-lip, turnout. In this case, this horse will be on 4 hard feeds a day. He's a very big horse, but he needs, obviously the stomach's the size of a rugby ball. So I want to be able to feed him appropriately throughout a 24-hour period. We do feed Saracen, we feed the Relieve. I'm a big believer in the acid buffers within the product. And the other thing we do before we work our horses, doesn't matter what level they are, they have a bucket of chop. They have a scoop of chop before they're worked. And so we go through what I would describe as the best management processes: the right feed, ab-lip, turnout, and lining the stomach before they're worked. If they're traveling, they may get a paste, or they would get a paste of probiotic before and after they travel. So that is how we would go through our processes at Nodwood, and that's exactly what we do for this horse. In addition to everything else, do we have the right saddle on the horse? How's it being ridden? But that goes beyond this topic that we're talking about today. So the scope was extremely informative. It answered the questions. We reset the button, but we still have to make sure that we manage the horse correctly, because we don't want the horse in a stressful situation. So our yard is very calm, and then we make sure all of our management processes are correct to limit ulcers.
Thank you. I'd like to bring Peter into the next discussion, bringing in actually the Relieve. So the Relieve would be one of our very popular rations that we would very commonly go to in situations of helping to manage horses that have gastric ulcer syndrome, because it is cereal free, it has the low starch level, it's also carries the beta EGUS approval stamp. But Peter, I was wondering if I could ask you, there are a lot of different questions that come in from people and different opinions with regards to what minimum or maximum starch level should we be looking for in terms of when we're feeding our horses. Are there, what are the correct guidelines? What is it that people should be looking for?
Thanks, Lizzie, and thanks for everyone joining us tonight or this morning from Australia. I think I don't know that there are absolute hard and fast rules about it, about how much starch you should feed, and one side of the line is great and the other side is bad. So I think minimising the amount of starch and sugar in the diet does help horses with, particularly with the squamous ulcer disease. And I think we need to differentiate, and Eamon and Jack said that these are two different disease processes, and this horse had both of them, so that was a bit different. So the glandular ulcers, we know a lot less about the risk factors as regards diet, whereas we do know the risk factors about diet in with the squamous disease. So I would say, is you've got to have some starch and sugar in the diet if the horses are working hard, and every horse is an individual, so you're going to feed them differently according to their energy needs for work and condition, etc. So, but Relieve does seem to work well with a lower starch, and I think some of the points made about having some food in the stomach when the horse works is really important. I really like that to be alfalfa based, so it's a bit easier for us because we've got a lot of lucerne out here. Can be hay, could be chop, whatever the horse will eat is, I think, the important thing. So Relieve, and the second factor about it is the the presence of the buffering, the buffers that are in there. So that are also in EGUS, for example, that give you a second bite at the acid buffering.
Can you just elaborate a little bit more on that, Peter, with regards to the role of EGUS and how a supplement like that would actually aid and assist with the buffering in the stomach?
Well, there's a couple of areas where I think EGUS can help, and one is that the buffer that we have in there that's sort of research proven to reduce gastric acidity and increase pH. And that's also in the feeds, but also the presence of the omega-6 fatty acids and the research showing that you get in EGUS or you get in other oils, some other oils, and their impact on prostaglandin production and acid secretion. So you've got sort of two things going for you. And the other real impact of EGUS is that it's such a high energy feed that you can feed less concentrate. So you can get your starch down in the rest of the concentrate feed. So its sort of impact in terms of its energy and starch ratio is really useful.
Thank you. You actually as well answered one of the other questions that I was going to ask as well, because one of the recommendations that we will use is sometimes obviously EGUS being one of them, but using either the corn oil or the rapeseed oil because of the roles with the prostaglandin. But I think what we probably need to say there as well is that this is about actually helping to try and help to minimize the risk, rather than people are actually thinking about strategies like that as being a cure for ulcers. It's just another one of those tools in that toolbox that we can implement to help minimize some of these windows of opportunity. One of my favorite strategies, I think that people as well find very easy to implement, is of course that pre-exercise chaff feeding. So feeding that meal of chaff half an hour before exercise when you're grooming, tacking up. And also, am I, from a veterinary perspective, physiology, am I also right in thinking that actually does minimize as well the diversion of blood away from the stomach, so that we minimize any of the reperfusion possible injury, or is that perhaps not quite so important?
I don't think we know how important the blood flow issue is. I know in humans, elite athletes have more glandular ulcers because of blood flow, being redirected to the muscles, it's thought. So, perhaps horses will have the same risk factor. But I think a key thing is stopping the acid splash that you get when the horse exercises. So putting something on the top of the stomach contents and stopping the acid splash is a key thing. And if it can be alfalfa based, it'll be better as a buffer. But the blood flow could well be a factor. And I guess having the thoughts about fasting. So the original research on risk factors that were done in Denmark, suggesting that fasting horses with reduced forage intake increased the risk factor. So that's probably related to just having food in the gut and blood flow there.
One of the points as well that Katie made, of course, is going back to the fact that horses evolved as trickle feeders. So having the emphasis on the diet, of course, being predominantly fibre-based, but also as well because of chewing and that saliva production, and saliva, of course, being really key in helping to neutralise the acid in the stomach. And we've had a very good question in relation to older horses, and older horses where dentition is compromised, or maybe we don't have any teeth at all, and what are the increased risks in situations like this? So if we have older horses that are not able to chew as much and supposedly then of course create lots of saliva, how does that actually affect their position with the risk to gastric ulcers, and actually how best would it be to manage this sector and this group of horses? That's open to Jack, Eamon, Peter.
I'll give an initial go at that. That's a really interesting question, and to be honest, I would suggest that the research there probably doesn't really exist. I think when we do a reasonable amount of geriatric, it's not an offensive term, it just means a horse that's age is now contributing to it has to contribute to management. Geriatric management of horses from a veterinary perspective. Dentition and it wearing out and no longer being able to deal with long fibres is a huge factor of that. And so I would say you would consider it from a gastric ulcer perspective. There's a lot of other things that you would have to be gearing diet modifications for geriatric horses towards, and most of that would actually be that would be mainly promoting good sort of health and the right microbes in the hindgut, because in geriatric horses a huge part of it is keeping weight on them. But that has to come from fibre, and it's really important that we make the hindgut very, very efficient at being able to give the horse nutrition from fibre. But because they don't have teeth that can grind long fibre into short fibre lengths, which is what that part of the gut needs, we often end up resorting to feeds that you can soak into the stock. It's a feed where a machine has done the job the teeth can do. So unfortunately, I think you have to be very careful with the really old ones when their teeth have really failed, because as much as they will want to eat long fibre hay which they do struggle. If they get too much of it, they end up with something called fecal water syndrome and loose droppings, basically, or watery poo that comes out before or after normal form dropping. So there's a huge factor in it. I think I put it in a lot of older horses, but probably less burn. So maybe some of the other risk factors for gastric ulcers are less. And I think we really have to look at older horse management quite holistically. So looking at all the problems rather than just one. And unfortunately, we might have to be balancing one thing with another. And I think, yes, maybe because they can't deal with as much hay and haylage, maybe we slightly increase their risk of gastric ulcers, but we have to do that to make sure we keep the hindgut, which is where the horse derives most of his energy from, healthy. And we can look at other factors as well. If you have a horse with Cushing's disease, it's not controlled, it's far more likely to have gastric ulcers, or they will progress very quickly. There's a lot of factors. It's a brilliant question. It's a really good question, actually. It's one we've been asking for. But I think, yeah, you would assess that if you're primarily gearing to protect the horse from ulcers, you're going to run into other problems. There's definitely a real balance there for the older horse.
So what do you think with regards to perhaps strategies to help manage the risk? They're using perhaps like ulcer supplements. So Peter, perhaps you've got some suggestions with that. So yeah, antacid supplements or stomach protectants, would these perhaps be useful in these situations to help minimize the possible risk, or to offset the risk?
Yeah, I think it's a really interesting question, and one thing I was just going to think of, that the older horse with worn out teeth is less likely to be working hard, so it'll take away the risk factor related to work, and that particularly seems to be evident for the glandular ulcer disease. The research showing that horses that work more had increased risk. In fact, older competition horses had a reduced risk of glandular ulcer disease. So there's some benefit of age there. I guess it's you often if you're producing less saliva, then you can supplement that with antacids. They tend to be often, unfortunately, they're relatively short acting, so you need to be giving them multiple times per day. So you've got antacids sort of in the feed, the Saracen feeds. You've also got other supplements that can be given that have antacids and coating agents that can help. So Right Track's one of those that we've developed, and that also helps the hindgut. So it's a combination thing that has a antacid and coating effect in the stomach and affects the hindgut too. So in terms of the inclusion of Equisure, buffering the acidity there. So looking after both ends of the digestive tract. But it's a combination of things that you're going to use, and depends on the horse as to whether it has the risk profile.
Again, treating each horse as the individual. What about microbes? So we know that microbes play a huge role in maintaining the health of the horse and the health and the stability of the hindgut when we have the friendly fiber digesting microbes in the hindgut. What about the role of microbes, bacteria in gastric ulcers? Is that a thing? Is that something that we need to be taking into consideration? What is it real?
Is that one for me, Lizzie, or
all of you?
Well, I'll start.
You start.
So fermentation of starch, in particular, I guess carbohydrates, by the microbes is an issue, because that leads to production of volatile fatty acids that can be really damaging to the gastric lining. And it's interesting, we did some research some years ago looking at different forms of corn, and we had highly processed corn, steamed flake corn versus cracked corn, and the increased digestibility of the steamed flake corn in the stomach led to a lot lower pH. We didn't look at ulcers, but just looked at pH, because it was so highly digestible by the microbes. Whereas the cracked corn sort of started to mess up the hindgut, because it wasn't digested in the stomach and was then fermented to acid by the bugs down there, and we got hindgut acidosis out of it. So you can certainly, that can be an impact. And I guess if you've got a horse that you've got at a high risk of ulcers, you're going to have pretty minimal amount of corn or maize in the diet anyway. But those sort of digestibility and by the bacteria of carbohydrate sources producing volatile fatty acids is certainly one of the damaging factors that we need to avoid.
So would there be some individual horses that would be more sort of susceptible, or that they produce more volatile fatty acids compared to other individuals? So would those type of horses then actually be better having that starch element or cereal element removed from the diet, or do they all produce volatile fatty acids?
I don't think, I'm not aware of research looking at the individual production, but you're going to get a variation in that aspect of it, just as you get a variation in gastric ulcer risk profile. And you can cure them with omeprazole, but sometimes with these horses, if you just go back to doing things the same as what you used to, then you'll get recurrence. So we're trying to, in some of those horses, just look at modifying the risk factors that we can. Some of them you can't change, and others you can. So, and there's no real way of measuring that. We can't take a blood and measure how much VFA production goes on. But we're trying to do things that address some of those risk issues that horses have in the chronically affected horse. Over to the boys. I'll put. I want to compliment Jack's November moustache there. That's sensational. That really is.
Thank you. Yeah, I think
you better put the donation. You better put the donation side up. People donate to you. It's super great. Great name.
Thank you, Peter. Jack, Eamon, with regards to, so moving now back to talking about some of the treatments, with pyloric ulcers, so with the glandular ulcers, they do seem, I mean, it seems that they are becoming, feels like they're becoming more common. There's more people that will phone and say that their horse has been diagnosed and has the glandular ulcers. And you did mention at the beginning as well that they tend to be, or they can be, the more troublesome ones to be able to treat and cure. Once a horse has been scoped clear of pyloric ulcers, obviously, like with any ulcers, the aim is to prevent them from coming back again. But with the glandular ulcers being slightly more complicated, what management strategies or supplements, what protocol would you be advising to help with that?
I think this is a really important point. We obviously had a case study that we showed there earlier on, and we've seen the dramatic improvement in this horse with both the squamous and the pyloric ulcers on the video within a 6-week period. And for pyloric ulcers, that was quite a significant improvement in the period of time between the two scopes. But it's very important that treatment alone, medicine alone, is not enough to cause this healing process. Management is absolutely vital. Peter alluded earlier on to, and Katie alluded earlier on to feeding horses before they worked. Management is very important. Feed is very important. Feeds like relief that are there, and there's scientific evidence behind that helps with having the right gut pH and elements inside it to prevent these ulcers from reoccurring. So while the medicines are good for helping the healing of ulcers, that healing does not happen without proper management and without proper feeding. And there's no way you'll prevent those ulcers coming back without ongoing proper management and ongoing correct feeding as well. So moving forward, they're vital things that we often, or some people, can overlook. And compliance with that management and compliance with that feeding regime is very important as well. Consistency of staff to make sure people are getting the medicines feed at the right times, and all of these things have to be considered. And certainly for me, who works quite closely with Katie and her yard, we will sit down, we'll go through the horse and the management processes to where we're going to go with each individual horse that we look at. And I think that's very important, and Katie and her team then diligently carry out all of the actions that we try to put in place to prevent these horses from getting ulcers again. So having compliance, it's a real team effort. It's not just a case of going in, diagnosing and treating. It's a case of people are looking after the horse, being sensitive to the horse's condition or its predisposition to a condition, and also the same for the rider. It's important that the rider is aware of the team effort that goes into trying to keep this horse right. And I suppose with the likes of nutritionists like yourself, having that input is very vital to keeping these horses on the correct side, and especially with the predisposition to these pyloric ulcers, which we don't fully understand, and that makes them even more difficult to treat. And with ongoing research, it's possible that in the future something might click. We might realise that the horse is lacking in something or needs something else. But unfortunately, at the moment, we're not just there with pyloric ulcers, although we do feel that we're more or less there with the squamous ones.
So from a supplement and management perspective with those pyloric ulcers, supplements such as KR Right Track, EO3 oil, or the Equidol, Peter, those type of supplements would be of assistance in these situations?
I think the most interesting one there with the pyloric ulcers or the glandular disease would be EO3, and that's because these are lesions are inflammatory in nature, and the anti-inflammatory benefits that you get from the fish oil in EO3 that we've shown and other people have shown, I think this has never been directly looked at in relation to glandular ulcer disease, but it makes sense to me that if you're going to, once you can affect a cure with omeprazole and sucralfate, you may not want to keep the horse on that forever. There's a few reasons why. Cost is one. also the potential impact of omeprazole on calcium digestibility, that research has shown reducing calcium digestibility is something that you might want to think about. So you then go on to other management strategies and increased pasture turnout, looking at reducing the amount of grain that's fed. They're probably the two dietary related risk factors have been identified. And but that's where I think EO3 makes a bit of sense, and it would be interesting to see some research into that area because of the anti-inflammatory benefits. And that's probably going to be more important, say, than the other couple that you mentioned in the glandular area, whereas they might be more beneficial in squamous disease. Certainly the antacid effect of right track and the coating effect, I think maybe more squamous.
So I guess as well with the glandular pyloric ulcers, stress being a factor. So in terms of management strategies, looking at minimising stress levels, because I think there was the mention as well that as horses mature or become more experienced, the prevalence or the risk to the glandular ulcers reduces. Is that true, or?
Yeah, that was some of the work that has shown that older horses have, and this is really not looking at individuals, but it's looking at population studies. So you seem to be more likely to get it in younger horses, and the number of days the horses worked a week seems to be a risk factor too. So giving a horse a few more days off. So the weekend warrior who only rides their horse on the weekend probably has a lower risk of this disease than the horse that gets ridden every day.
Another question with regards to how much feed, how much forage. Now, we have a really big problem here in the UK with an ever increasing population of horses and ponies that seem to be growing in size and roundness. And for many of those, obviously, we're looking at restricting or reducing calorie intake. And it does mean that in a lot of circumstances, then the amount of feed and intake, or the amount of forage perhaps that you're able to feed, has to be reduced. And that could be because actually, it's not practical, or there isn't a lower calorie source of forage or fibre to feed or available. Are there other management strategies that we could use? So I'll give an example of something that we do, or we work with, where we are working with some of these animals as well, where the risk of metabolic disease and laminitis really is becoming really quite a key factor. And that is actually, if we're looking at restricting, if we have to restrict for access to forage and the fibre side to reduce the calorie intake, is to do that restriction or minimise the access actually at night, rather than actually leaving them for longer periods during the day with nothing to eat. So kind of sort of going on the basis of, you starve horses at night from, let's say, 7 in the evening till 7 in the morning pre-scoping, because you won't find ulcers. Whereas if you were to starve them from 7 in the morning till 7 in the evening during the day, you're more likely to increase the risk of ulcers. What are your positive, negatives, thoughts on strategies like that, where yes, we have to restrict that calorie intake because we're running out of options with regards to actually trying to bring that calorie level down because of available feeds? And also as well, in a lot of these situations, it's not practical to either be able to increase energy expenditure enough, or actually they can't be ridden anyway because they may be lame. And that's I'll put that to Jack and Eamon first.
Yeah, it's definitely. I think we'll probably look at each other and have a little smirk, because if we go to do a gastroscopy on a horse that's effectively obese, you're a little bit hesitant to vet because you're very aware that as soon as we diagnose horses with gastric ulcers, a lot of owners, and you can completely understand why, they become very concerned and very focused on ensuring that horse is not without food in front of it all the time because they're so worried about the ulcers coming back. But obviously, its vets are also worried about a horse that's already overweight and that being an issue. I think the main stay of it has to be effectively calorie dilution, because you want that raft. It's obviously, when we see these gastroscopes in these videos, these stomachs are completely empty, which is completely artificial. If we did a gastroscopy in a horse that hadn't been starved, that gastroscope would get into the stomach and you'd just be presented with this wall of food. And it effectively acts like an enormous sponge. If you had a bowl with a little bit of water in the bottom and you walked around with it, some of it's going to splash up the sides. That's effectively what happens in the formation of squamous ulcers, the ones that affect the top of the stomach. If you put a sponge in the bottom of that, soak up all the water and you walk around and you get no splashing, that's exactly what happens when a horse's stomach is appropriately full of food. So I think, yeah, a huge portion of it is making sure that we're giving the horse the most calorie non-dense feeds we can, and so we're making sure that stomach never is empty, but maybe it's not stuffed full, but equally anything that's going in there is very low calorie density, and then we're topping it up little and often. But again, this is the practicality aspect. It's fine if you've got 8 people on the yard that happen to be at hour intervals through the day. They could all put one of the tiny little trickle nets in, and that horse is having a small amount of feed, and everything's going really well. But if like most situations, you're there in the morning and you're in the evening, nothing else, it is really difficult. So you come up with the strategies to how do you make that portioned amount of food last longer. You go for these trickle nets that have tiny holes. You can double net a hay net. We have some clients that even hang, and they've had real success with it, hang a trickle net from a rope on the seat. Be a little bit careful with the height to make sure the silly horse doesn't do something really silly. It frustrates the horse. So you might say, well, hang on, I don't want to stress it out, and that's angry to cut it. But there's a balance, and everybody has to know their own horse and what's going to work, and weighing out, making that food last longer versus the horse being stressed by the fact that it can't eat. So there's always a balance there. But I agree, if you're going to portion the food out 2/3 to 1/3, yes, I would give 2/3 to last the horse through the day versus 1/3 at night, so that hopefully it sleeps overnight, and so you're not doing it. But certainly when they're looking for studies of inducing gastric ulcers, most of the original models are all based on intermittent repetitive starvation. So starvation for 24 hours, food for 24 hours, starvation for 24 hours, done over a few days. All horses will get quite severe squamous ulcers with that. So it's not necessarily a one-off incident of a horse being starved, but it's repeating that. And sometimes you can have a horse that's in a field, and you say, well, I don't understand why my horse has developed ulcers. It's in the field all day. But unless it's eating, that horse is still being starved. And I think sometimes anything is put into place, but if it's not eating, it is being starved. Sometimes the horse is submissive, it's getting bullied. Sometimes it's a stressed horse. You get the odd ex-thoroughbred that goes out into a huge field of grass, turns around at the gate and stands there saying, I want to come in. So we would say, well, you should be fine. You're out in the field full of grass, you should be happy. But if that horse isn't settled and eating, you have to adjust the management to minimize the risks.
So it's a little bit like, rather than don't order carrot cake, but order a fruit salad. So we're looking at like actually, and this actually leads on, because there've been a couple of questions that have come in that have mentioned the use of straw. So straw obviously being lower in those calories, but straw previously as well being linked to increasing or aggravating gastric ulcers. I believe there's been some recent work that has come out that suggests that actually that's not the case. Peter, back this one to you. Opinions on that? Perhaps you can elaborate a bit more, yes, on the recent the recent findings.
I'm glad you can still get fruit salad in England, Lizzie. Anyway, I thought with Brexit you weren't getting fruit these days, so I'm really glad to hear that you can. I think I want to go back a step and say that obesity and laminitis are much more serious disorders than gastric ulcers. And so you have to look at what's the most important thing, the important consideration with the horse's health. So, a lot of horses can have gastric ulcers and can appear happy and can perform really well. So not every horse with gastric ulcers is a welfare or performance risk. So yeah, I'd always put obesity and laminitis as more important considerations. Straw, yeah, the original research identified the feeding of straw as one of the risk factors, and probably what that means is the horse doesn't eat it as much. So it's probably all about reduced intakes compared to offering hay or haylage, and that may be good in terms of reducing calorie intake and keeping weight off the horse. But in terms of gastric ulcers, then you don't have the chewing, you don't have the buffering, you don't have the saliva production, you don't have the food in the stomach buffering. I think, yeah, there's some trade-offs there. Whether there are any other physical properties of the straw in terms of that are damaging, we're not really sure about. But certainly, I think it's related to palatability. And in a fat horse, that's what you want. You want to offer them something but less palatable forage. And that's probably more important than the gastric ulcers. It would be, so maybe it's a mix. Maybe you use a mix of straw and hay in that situation, or using things like washing the forage that reduces soaking and washing reduces the dry matter and the energy content.
Okay, thank you. Question, how long does the chaff feeding last for? So if you were, for example, competing in eventing or doing long distance riding, at what point would you need to refeed? So I guess this is talking about, intervals in between feeding. Are there, what would be the recommended maximum amount of time, I'm guessing here, where you would then need to either, I guess, hand graze, give another chaff meal, or allow access to a hay net?
I think Peter's probably a better person for the science behind this, but I know from us dealing with these things out and about in a practical sense with competing horses, we would always recommend that horses are fed, that are particularly those horses that are predisposed to ulcers, are fed right up until they perform, and be that eventing and to give them a handful of chaff before they go and do the cross country. And it's not a problem for these horses, and it's very important, as Peter said earlier on, to try and keep this acid splash back. And so I don't know the science behind it, but I know that that's what I recommend. And horses that are traveling, I'd always recommend that they go with hay net. I think it's good when they're traveling as well to be eating some fibre food. And if a horse is at a one-day event, for example, I would give it a handful of chaff each time before it warms up and before it competes. But that's what I do. And there's no science behind it, but that's what I advise.
And we would give a mash on return. So once you finish one day event or whatever, we would do a hydration mash. So like the
Recovery
mash. Thank you. So exactly the same as we'd feed all the way through.
Yeah.
Handfuls though, not talking buckets of feed, but access to forage is really important.
And I think with things like hydration as well, of course, if you're feeding those fibre or chaff meals as well pre-exercise, that's acting as well to help maintain hydration, sitting in that hindgut, trapping the water, trapping the electrolytes, just to help actually maintain those hydration levels through exercise. Peter, perhaps you could just elaborate a little bit more on the intervals, so time frames between feedings when we're going to really start significantly impacting on those acidity levels in the stomach.
I think that's not something that's necessarily been studied directly, but we do know that the horse's stomach starts to empty pretty quickly. So food is getting out of the stomach within 15 to 20 minutes. So I think if you've got a long gap between the last meal, then giving another one makes some sense. So and I'd give the double handful of chaff. That's my recommendation rather than or giving the horse access to hay again. So I think the horse
maintaining that trickle feeding of fibre. Another very common question that we actually get asked a lot, and it comes onto the helpline very frequently, is this issue over what to feed. Do you feed hay or do you feed haylage? Is haylage bad to be fed, or wouldn't be recommended to be fed to horses with ulcers? Particularly, and there are some horses who don't like eating hay. They prefer to eat the haylage. I myself, as long as it is a good quality haylage, it isn't a wet haylage. The importance here being that actually we need to be maintaining dry matter intake and and the chewing and the saliva production, and also as well looking at the diet as a whole with respect to calorie and energy contribution. Peter, anything else to add to that, or?
No, I think it's what the horse will eat. If you've got you need to have a good quality haylage would be better than a poor quality hay, and the reverse. There was some research in New Zealand looking at quite a wet lucerne haylage, or quite a high high moisture content one, and they found they associated reduced ulceration prevalence with feeding this, adding this to the diet. So you can do it with the wetter haylages as well, but people have to remember they're feeding a lot of water then, so you often miscalculate the amount of dry matter that you get in those circumstances. So I don't think the benefits of one versus the other. I think lucerne alfalfa over grass has benefits, and you get the extra buffering effect related to the protein and the calcium, and then getting the horse to eat is the other thing. So we can have all the great ideas in the world, but if the horse won't eat it, then it doesn't help it.
Absolutely, it's a bit of a non-starter, isn't it? Yeah. I've heard that limestone flour is good to minimise stomach acid, but that it can cause kidney problems. So I'm going to put this to Eamon. Or Peter? It's like a double one here. This is like.
Yeah, I have to say I haven't a clue, I'm afraid. I'm not aware of any research that's being done with respect to using lime flour. It's not something I've ever used. It's not something that I'm aware of the benefits that people feel it's had in cases. So
kidney issues, you haven't come across kidney issues as a result?
In practice, I certainly haven't come across it even being used.
Limestone and acidity in the stomach, Peter, neutralising.
It's going to have a slight buffering effect. It's not going to be the calcium. There is some buffering effect, but it's pretty minor. It's not like the ones that you're going to get the other buffers. As for its effect on kidney issues, if you've got a horse with renal disease, you probably want to minimise calcium intake that you're going to get from the limestone. But high calcium diets may make the urine look more cloudy, but doesn't mean the horse has kidney disease. It's like the overdiagnosis of kidney disease. Eamon and Jack would hear this all the time. Oh, the horse has a sore back, and somebody says, oh, it's got kidney problems. I think it's very rare in horses, so you shouldn't be worried about that.
Okay. This is a good one. I have a native pony who came down with duodenal ulcers last winter. Does this fall into the category of hindgut ulcers? And so feeding would be unlikely to be a risk factor in this case. Now, I have to be honest here and say that I haven't personally dealt with duodenal ulcers, so
I'd have to say I personally haven't either.
Three on that. In horses, the duodenum is relatively short, so it's the first part of the small intestine. So when we did the scope video, the black hole you can see in the stomach, that's the pylorus. The other side of that is the duodenum. We do routinely look at it in horses. We didn't bother showing it in the video, slightly off topic. You can't see a huge way. basically the first thing you see is actually the emptying of the bile ducts. So horses don't have a gallbladder. They constantly just secrete bile into the small intestine, which horses are evolved to be trickle feeders, so that's part of their makeup. But yeah, I would agree. We've scoped hundreds of horses, and we've never seen one with duodenal ulcers. It wouldn't be classed as a hindgut ulcer. The hindgut is generally considered cecum and backwards. So cecum, large colon, small colon. So it wouldn't be considered a hindgut lesion at all. But yeah, I can't even think of a case that somebody I know is treated.
We don't often go into the duodenal scopes, but the scope that we have is certainly 3.5 meters long. For the larger horses, you just get down to the bottom of the stomach. It's not long enough to go any further. With some of the smaller horses, I think you said that this was a native horse's case, you could get into the duodenum with a scope that length. I would be inclined to be looking as to why that horse has duodenal ulcers. I think that this isn't your typical type of ulcer. It's not recognised ulcer in horses, and I'd just be wondering what other medication this horse was possibly on, or is there another condition that has caused this ulcer, rather than this be the true ulcer syndrome that we're talking about this evening. Yeah, I've never come across them before. So.
Peter, is that something that you have?
Well, I have heard of them being diagnosed, and again, I think that's just part of the continuum of glandular disease. So, well, that would be the expectation. But they're pretty rare, and so you would look at managing them in the same way you might manage glandular disease. And so you've got 20 meters, or maybe not in a native pony, but you've got at least 10 meters of small intestine before you get to the hindgut. So definitely not hindgut.
This
the
is
bile is bile acid is certainly quite damaging to the stomach. So perhaps that's a contributor to in some horses to increase to damage there in the duodenum.
Okay, thank you. This is another common question as well that we get asked, or people certainly experience. Is it usual for ulcers to become inflamed with the change of seasons? My mare finds it very difficult to cope from summer to autumn, and we've had it as well where people have issues going from autumn to summer. Now, is this actually just more linked with changes in routine and feeding patterns, or is there something seasonal that is playing a role here?
I would say, and it's interesting, I was going to sort of chip it into a bit about hay, haylage, alfalfa, what you feed. You just get huge variation. You can have a horse on the same hard feed, and you could argue you have the same cut of hay and you don't have to change suppliers, so the hay is completely consistent. The thing that always changes with time of year, weather, especially in the UK, it's the grass. It's constantly changing, and its sugar content and its starch content and its fibre content will completely change the whole time. So sometimes it's with the seasons, like spring grass consumption, it's incredibly high in sugar starch, and vice versa. But equally, there's lots of other things that we term stress the grass, and will then change its nutritional makeup. And so I think that's a huge factor in it. Yes, there are other physiological changes that happen in horses to prepare them for the winter. Certainly in older horses, if you get problems in autumn, that coincides with the autumnal rise in ACTH levels, so PPID or Cushing's disease. So again, if you're having horses having problems there, depending on their age, could be related to that. So there's lots of different factors, but it comes down to, just because you assume that you haven't changed the horse's management doesn't mean that what you're feeding them hasn't changed. I think within the area of the country, and sort of the south of England, we've had some enormous changes in the nutritional value of hay that we've been feeding horses in the last couple of years. We've had problems with yard outbreaks of laminitis, and you've looked at the hay and it looks the same. It's just rocket fuel.
Some of it's like a racehorse feed.
It's like a dairy farmer would bite your arm off to feed it to cows, get the milk you, but it's rocket fuel. And if you've got a horse that's extremely sensitive to changes in dietary sugar and starch, and all of a sudden it ends up on hay that looks the same as your last stuff, but it's completely different, it's nutritional makeup, that can be enough to stir you up some problems. So I think it's really difficult for us to say what change has precipitated a change in a horse's behaviour, because there's so many things that can change. And again, it'll change from one farm to another, one field to the next. You know, there's a huge number of things that can be involved in that.
I think it's important to say, you said earlier on that stress is a factor in these pyloric ulcers, and then the question, we don't fully understand this pathway. We keep on saying stress, but we don't know how stress influences these ulcers. And what is a stress? A stress could be a lame horse, which is causing the horse pain, and that can instigate ulcers or potentially. We see an awful lot of lame horses that have ulcers. And could hormones and the way that this mare feels be an influence on, could that be a stress for her that's causing these ulcers? And I think these are all things that should be considered. Ulcers, as we said, diet is important, management is important, but there are lots of other factors. It's important not just to focus on ulcers, it's important to look at the whole horse and make sure that there's nothing else there that potentially causing these ulcers to pop up. But hormones potentially could be a stress factor.
This is, I know it's not practical for everyone, but we as routine, we hay the fields all year round. So there's access to grass and hay, and we manage the amount of turnout that certain horses have, and it is based on the individual horse. Some horses will go out for a period of time, others will go out overnight, others will go out all day, and I know we're in a lucky position to do that, but we do feel that gives them the best all-round management.
And you're able to actually cater for those more individual horses and their different requirements.
We have some on soaked hay, we weigh, we're meticulous, so we know exactly how much we're feeding that horse. The horses get weighed, their temperatures are taken, it's the whole piece, and that is, it's time consuming but important.
Absolutely.
Now we didn't talk about hydration. Water intake is also really important. We spoke a lot about food, but keeping your horse hydrated, particularly in the winter months. We would feed mash warm. When they're not drinking the water because it's gone cold, we actually heat the water up. They have warm buckets of water. I mean, it's like living in a hotel. But it is really important that they keep hydrated. And we're not on automatic waters purposely, so we can actually see and monitor how much water they're taking. We have one horse that will always drink from one bucket. It will never drink the same water from the other bucket. And so some of them are a bit quirky. Some need a little bit of apple juice in their water, but that I would say is very, very important. And I know we haven't touched on it, so to keep your horses hydrated.
No, well, thank you, Katie, because being deprived of water has been identified as being a risk factor in gastric ulcers. So thank you very, very much for that. And this is a good one, and this actually is the question: do we need vets? So can gastric ulcers heal without being treated?
I suppose everybody will have an opinion, of course. As I said before, I think if a horse has gastric ulcers, I think it's a team effort. I think that the treatment, I suppose with vets, you're relying on the vet for diagnosis. I think it's not possible to diagnose gastric ulcers without a scope. You're relying on vets with respect to giving information and advice on medication. You're relying on the team looking after the horse to be reliable with the way they administer the medication and the yard routine and getting the appropriate feeds. We're relying on the nutritionist for giving us the advice as to which feeds in order to be able to minimise the chances of these horses developing ulcers again. So I suppose from a selfish point of view, I would say yes, we do need vets, but it is very much a team effort in order to treat and keep these horses from getting ulcers.
Thank you.
I think it's possible, Lizzie, that they can, but only if you change the risk factors. So if some of the risk factors are high grain, you've got a horse working hard on a high grain diet, unlikely to heal. If you take that horse and chuck it out in the paddock with grass and hay available, and you cut the grain out, yeah, they might. Particularly the squamous ones. The glandular disease is, I think it's a really important thing I think that that's a different disease process and is much harder to heal. Omeprazole alone does a great job of healing the squamous ulcers, but has a low success rate in glandular ones. So that's why putting the omeprazole and sucralfate combination here is the sort of state-of-the-art way of managing those. So, but yeah, it is with simple squamous ones. I think it's possible, but not so good if you want to ride the horse.
Okay, thank you. One for you, Peter. So Peter referred to the benefits of corn oil for horses prone to ulcers. A paper in 2004 found a decrease in acid and increasing the PGE2, which is what we touched on. There was also the suggestion of the EO3, so going from our omega-6s to our omega-3s. Which one would be of greater benefit, or do we need a combination of both?
Yeah, it's a good question with lots of open endings. So I specifically mentioned the EO3 in relation to glandular disease because it's an inflammatory disorder, and that we're wanting to look at that can have an anti-inflammatory effect. We know that. So I wouldn't think of that in terms of necessarily routine squamous ulcers. And by the same token, the impact of the research showing the impact of corn oil didn't look at ulcer degree, it just looked at acidity. And I think looking at the fact that omeprazole alone does not solve most glandular disease, but does solve squamous disease, then I think the impact of the oil or oil sources such as Equigel will be much greater in squamous cases than in glandular cases. Does that make sense? I think you've got to differentiate which one you've got, and to do that you've got to scope the horse. So you do need vets.
We do need vets. We're going to have to start winding this up shortly. We've had so many questions that have been coming in, and we will get round to answering them all. I promise that we'll do that as soon as we can, and be farming some of these out, I think, to Peter and to Jack, Eamon and Katie for their input. So we will get back to you, but just a couple more before we end. I'm trying to kind of sort of get in some of the treatment ones, the feedings, and management. Can horses stay in full work while the ulcers are being treated?
I mean, I'd say they can stay in full work in the same way that you don't have to give a horse medication if it's got ulcers. It's a choice, but like we've alluded to, in a lot of cases, it's managing your risk factors, and certainly for squamous ulcers, increased exercise duration and intensity is a significant risk factor, and there's certainly evidence for glandular disease as well. So I think it's a case of it's up to you and how bad you feel your horse is affected by them. But certainly we would expect that a horse that has its workload reduced or is rested will probably show improvement in clinical signs and ulcer score quicker than a horse that stays in a full level of work. But I think it's all relative. It's up to each person to make that decision, but certainly for squamous ulcers, we normally recommend that they have a period of significantly reduced work to start with, to let things start to settle. Glandular ulcers, they're on treatment for so much longer. There's a practical aspect. You don't want your athlete to then just have 3 months off while the ulcers heal and have lost all this condition. It's not practical at all. So I think it's you weigh it up and you make the choice yourself as an owner. Yes, there's benefits to reducing the workload, but I wouldn't say you just have to sort of rough a horse off and throw it out in the field until they're better. That's kind of the other end of the spectrum. So there's a balance. And plus, some horses are much calmer when they're in work. Some horses you take them out of work and geez, you've got some kites on your hand as you walk across the yard, all of a sudden it's in the air rather than on the ground. So, it's applying it practically. There's a balance to be had, and each horse will be able to do.
I think reducing the work is the approach that I would normally take for a period. And so I feel that ulcer treatment has had a chance to work before they return back to exercise.
And just on the work subject, actually, and Peter, you mentioned it before, and it is again something as well that I will talk to people about in terms of sort of, you know, the management of horses with ulcers and just trying to minimise the risk. And this the idea of the rest days. Now, a lot of people ask, do rest days, do they have to be on consecutive days, or can you have a rest day on a Monday and a rest day on a Friday? Does it actually matter the sequence or the order of the number of rest days?
I don't think we know.
Another so
Who
many
knows?
I know. Yeah.
It would take some interesting research to investigate that. What it's done is identify that horses that worked more days there was an association of an increased incidence of glandular ulcers in those horses. So you go in the other direction, is putting some rest days in there. So, but it's sort of whatever is achievable often. It's what works best for the individual rider, rather than knowing that you have to have 2 days off in a row.
We often try and do a day off, and the next day is a very light day. So that could be a treadmill, a walk on an incline with the horses moving in a straight line. And so for those two off days as such, one is an off day, they're out in the field, they're grazing, completely let down as such. The next day is a light day, normally straight line work. And then they're back into sort of a heavier workload the day after. And we find that works really well for the entire sort of view of the horse. And they're all in quite significant work.
Thank you, Katie. Thank you.
And the other, Lizzie, I was just going to say one more thing, again, relating other disorders. You might have a horse prone to tying up that you can't give a day off to, otherwise it will tie up.
True.
So you've got those, or it wants to, buck the rider off on the next day. So you've got these things to weigh up.
They need to talk to their nutritionist then, don't they?
They do. Get them talking to you. So it's looking at the totality of the horse.
Another couple of quick ones. Does dirt licking eating, could that possibly be an indicator of gastric ulcers? Just put my little 2 penneth in there, and I would suggest in these situations anyway, you're looking at the diet, having a review of the diet, but actually then looking at salt or electrolyte level. So any comment on that, Peter?
I guess that's one of the speculations that as to why horses eat dirt, is that they're looking for some soothing impact, or maybe it's bacteria in the gut, but whether it's related to gastric ulcers, we have no idea. Just commenting, be wary of too much salt and electrolytes and in a bolus, and the impact that will have on the horse with ulcers. So we've got a buffered electrolyte pace for that reason. So beware of that. And you see it sometimes with saline drenches, you get the horse cringes, and you think, when you put that down, and you think, gee, that horse has got ulcers. But be wary about salt and electrolytes there. But salt may be one reason why the horse is eating dirt, so that I can see where you're going with that part of the question.
Thank you. And the last one, I think, to finish up this evening, otherwise I think my guests here, you're all going to be here all night or all day, Peter, in your case. But the last one, any potential for a diagnostic test for ulcers, some biomarker or similar, that would negate the need for endoscopy? I don't know.
I guess the answer is, the research is probably that is people are certainly looking for biomarkers for lots of diseases. I guess the question is that's not the only reason we do gastroscopy. It's so we can monitor improvement. And also, I guess the other factor, the huge portion of this, especially with glandular ulcers, is at the moment we don't understand how they occur. We think that they're very much an inflammatory process. But when we look at lots of other areas of veterinary medicine where in the past we've been slightly in the dark, and then technology changes and now we're able to, say for instance, horses that used to be diagnosed with navicular, now we have MRI scans and we can break that down into multiple injuries. Now we understand it may be that with glandular diseases, we see them as different entities. So the horse that we showed in the video today had these raised inflammatory nodules. Sometimes we see linear streaks of redness. Sometimes we see these horrible, almost like cigarette burns, deep cavitating ones with lots of fibrinosuppurative material. So it may be that we find out that actually there are multiple different causes and actually we should treat them in different ways. That's possibly something in the future. But so it's not just saying, does a horse have ulcers or doesn't it, which is what you'd be probably suggesting if you had biomarkers. You're saying, where are the ulcers? How does that change our treatment? And then on a rescope, you're monitoring the response to treatment, deciding whether you stay where you are or do you change the treatment plan. So yes, there could be tests in the future that say, does a horse have ulcers or doesn't it? But the likelihood is they're going to say yes or no, not what type, where are they, how bad, and therefore how should we treat them. So yeah, there could be, but I still don't think it's going to replace gastroscopy because it's just too useful in too many other ways.
Thank you. Well, I guess this is the time where we'll draw this to a close. Thank you so much to all of you who've stayed tuned in and listened. It's a fascinating topic and never get bored about talking about gastric ulcers. Thank you for the huge number of questions that have come in. Sorry that we haven't been able to answer them all this evening, but as I've already said, we will be getting back to you all with all of these questions. I would just like to obviously thank my guests. So thank you so much to Katie for coming along, Eamon and Jack, and obviously to Peter all the way there in Australia. And also as well, just actually to convey my thanks to the team that have been working really hard behind the scenes to make these seminars come and work. So that's the team behind the scenes at Saracen Horse Feeds and also as well at Kentucky Equine Research. So thank you, because without you guys, we wouldn't be able to do this. So thank you very much. Any questions, please as well, feel free to email us at info@saracenhorsefeeds.co.uk. And in the meantime, thank you very much and good night.